Welcome back. This is a continuation of our series of interviews with new faculty members. We're so thrilled that you're tuning into the website of the Medical College of Wisconsin Department of Surgery. And we're lucky enough to have Dr. Tim Geier here with us today. And Tim's also a veteran of the Word on Medicine, our radio show. I'll give a little pitch for our radio show. Heard every Saturday on WISN at 4 p.m. and the latest Word on Medicine every Friday at 2 p.m. I know many of my faculty will make fun of me for pitching a little ad for our radio show, but Haley's given me the pass on that. So Tim grew up in Madison, Wisconsin. I think people tuning into this video would love to learn a little bit about you and where you grew up and why you ended up going into psychology, all those things. But you can kind of tell us a little bit of your life story.
Sure. As you had mentioned, I grew up in Madison, Wisconsin, born and raised. A big Wisconsin family as well, with strong ties to Milwaukee. So that really kind of motivated me to kind of move here and find a home here in Milwaukee. In terms of psychology more specifically, I've always been very interested in helping people out, which I imagine a lot of the folks going into our line of work have an interest in that. In undergraduate school, I was originally...
And that's Marquette?
At Marquette, yep. So again...
You wouldn't want to go outside of Wisconsin, right?
No,
it's dangerous to go outside.
I spent a little time here and there just to get my feet wet, but always coming back home. But yeah, I was originally studying the biological sciences with the intention of going into to the medical field as an MD. And you know, the underpinnings of chemistry and biology were very tangible to me. You know, 2 parts hydrogen, 1 part oxygen, water. At that same time, I was also taking a course on the theories of violence and nonviolence, taught by a veteran who was very open about his experiences with post-traumatic stress disorder. And so that really got me thinking and curious about how those laws of nature, biology and chemistry, are there ones in terms of the human experience? So that really kind of made me switch gears and focus on psychology and more specifically the experience of traumatic events.
And most psychologists will have a PhD, just for some of the people who may be tuning in and not realize that. Certainly the psychologists that we employ in the Department of Surgery, those that are on our faculty, all have a PhD in psychology, correct?
Correct, yeah. So, you know, I went to UW-Milwaukee, so again, not leaving too far from home there for graduate school, got my master's in psychology as well as my doctorate in clinical psychology.
And in clinical psychology, most of what you do is really direct patient care, even though there's a research component to it, correct?
Correct, yeah. So we're clinically trained. We kind of go through our paces, you know, so as part of my training, I worked at the VA here in Milwaukee. I also spent some time in Minneapolis at a level 1 trauma center, really getting that nice clinical experience. That's also met with, you know, designing and implementing your own research studies, informing your clinical practice with research as well.
Yeah, we've done a couple radio shows on the importance of psychologists in clinical medicine. And in the Department of Surgery, we have a big influence of psychologists in the Division of Trauma and Acute Care Surgery, where you are, Tim, also in solid organ transplantation and in surgical oncology. And I guess if I could put it all into oversimplified buckets, in our department, all of the psychologists specialize in dealing with relatively normal people dealing with life-changing events, as opposed to in perhaps, say, the Department of Psychiatry, where they're dealing with a lot of psychiatric and psychological illnesses that are inherent to the patient themselves. How did you get interested in the area of trauma? And you alluded to this a little bit at the beginning, but also expand upon the importance of psychologists in trauma and in the injury arena.
Yeah, so through my graduate work, through my clinical work and research, I really became interested in the connection between the mind and the body, and how they might interact. And certainly, medicine, there's a lot of focus on the body, which makes a lot of sense. But these folks who are living their lives and something really kind of catastrophic occurs, disrupts that, whether that be acute medical illness or an injury, which is often the case that we see here. That brings up a lot of difficult emotions that can certainly impact how they're behaving, how they're engaging, and how they're moving through their recovery. So I view my role as helping that individual go through a very odd and scary experience, and how do they make sense of that in a way that allows them to move forward and build a meaningful life as they were before all of this happened.
It's so important. I mean, I think in medicine we can get our arms around a heart attack or a cancer diagnosis, or reflux that needs to have some type of correction at where the esophagus meets the stomach. But the whole area of our emotional health and mental health, especially for those of us who aren't in medicine, and even for those who are in medicine, is so difficult to wrap our arms around. And it's fascinating. It seems like the older generations, the people perhaps in their 60s, 70s, and 80s, have a little bit more difficulty accepting psychological help than the younger generations. Do you find that, or how do you get those people who oftentimes need your services the most? How do you get them to accept them when oftentimes they associate a psychologist with helping someone who's schizophrenic or bipolar or something like that, right?
Yeah, and unfortunately, and you're very much alluding to the stigma and the shame that surrounds mental health and the difficulties that can present with that. And I part of my job is to really help normalize a lot of what these individuals are experiencing, right? They're going through an abnormal experience and yet expecting themselves to feel normal. And so, part of my work is really to normalize that and reduce that stigma around mental health. And in my view, mental health is health, right? The same way that physical health is health. And so kind of working with that individual, with where they're at, with any, perceived hesitation with them, kind of exploring some of their concerns and trying to get some buy-in there. And I think
so
most people
important.
are open to it.
We've had, as I mentioned, we've had at least 2 shows on the Word on Medicine devoted to the importance of psychologists in the practice of medicine, especially surgery. And I'd encourage anyone who sees this video to go to that website, the iHeartMedia website, search the Word on Medicine, and listen to those shows. I think really neat. We had a number of patients as well.
Yeah, I remember one of my patients came in with me, and it was a really fantastic experience.
Yeah, absolutely. Great. Well, in our last couple minutes, Tim, what do you do outside of work?
Well, I really enjoy music, both listening to and playing. So I play the violin.
Oh, wow.
Yeah.
Really neat.
So I really enjoy that. I enjoy kind of the creative aspect of it, the emotion and the intuition behind it, but then also kind of the theory and the skill and the practice. And I very much kind of find that it mirrors my practice of psychology as well, right? Kind of grounding my work in empiricism and science, and then kind of using my creativity to apply that knowledge to the individual's unique lived experiences.
Wow. So are we going to see you on the stage at Summerfest?
I don't know, but I am entertaining the idea of joining the MCW orchestra. So.
Oh, great.
Yeah.
Great. Do you need an agent to help negotiate that?
We'll talk later.
We can help that, exactly. Yeah. So, Dr. Tim Geier, thanks so much. Really great to have you with us today, and we're so thrilled that you're here in the Department of Surgery.
A pleasure to be here.
Okay, thanks, Tim.